This is Kathy Philbin coming to you from sunny South Florida, and I just want to give you a little bit of an update on what's going on with the COVID-19 virus and what a patient would expect to happen upon their admission to the hospital. So a lot of the patients are concerned. They are not sure what is happening, and as you know, things change actually on a day-to-day basis. So currently what's happening in South Florida is that when a patient is a scheduled patient for procedures such as a C-section or an induction of labor, those patients are being asked to come to the hospital approximately 4 days prior to the procedure date, and they are doing COVID-19 testing for that patient, so that on the day that the patient arrives, that those results would be ready for the obstetrician. So the patients then, if they were positive, then they would be placed in isolation, and the nurses would be able, and the physician or midwife would be able to dress appropriately to protect themselves from procuring the COVID-19 virus. So that is if the patient has a scheduled procedure. If the patient is coming in and they're in active labor, then they're doing rapid COVID-19 testing. And then the same thing applies. If the rapid testing comes up positive, then that patient will be isolated, and the nurses will don all the appropriate gown, gloves, cap, mask, and they will take care of the patient in that manner, and just make sure that at the time of the birth also that the baby is not exposed to the COVID-19 virus. So this is where it gets a little bit difficult, because we're not all doing the same thing. So not all hospitals are following exactly the same mandates. So my advice is to basically ask your obstetrician or your midwife, like, what is the procedure for our particular hospital or setting that we're going to have the baby. And the concern is that the baby, most often when born, is not contaminated with the COVID-19. There's only been a few neonates or newborns that have contracted the virus, and so their concern is that they don't want the baby to be exposed by a mom that they know has the virus or any other personnel. So that is why they're still at this point testing any person that comes into the hospital or the facilities, like, to make sure that we do not have fevers or any symptoms of the COVID-19 virus. So what in fact are they doing with the newborns? Some hospitals have made the decision to take the newborns to the NICU or the nursery and place them in isolation. Others are putting the babies in what they call an isolette and keeping the babies in the room and allowing the patient's guest, or most often partner, who is asymptomatic and hopefully COVID-19 free, to take care of the baby in the room. And then, as a previous video, we discussed how a patient can continue to breastfeed or at least pump her milk for her newborn. So this person would be helping her take care of the baby and using, good clean techniques like washing their hands and changing the baby's diaper and touching the baby for care measures by using good clean techniques. So this is just a hard time for moms and dads to be, and family members, and everything keeps changing on a daily basis, as we said before. But as we know at this point, this is the current procedures that we're doing, and hopefully, it does seem like things are opening up more and more. They're actually now, for other procedures, they're allowing other family members now, one person, to come in. So if you had, your scheduled gallbladder removal, now you can have a family member with you. So hopefully, as they keep, relaxing some of these protocols, then this will just, all of this concern will just kind of slowly go away. We'll see what happens, but hopefully this has made you feel like a little bit more in the know and give you a little more confidence for your admission in the future to the hospital. So take care and stay safe, and I'll talk to you soon. Thanks. Bye.